For Friedberg. One of your exceptions there was investments in science. You want to talk about your opinion on the quality of the grant process at the NIH and whether we're doing the real work necessary to get the right things funded?
Yeah, I mean, I think it's a good transition to what happened this week, which was that there was a major potential fraud uncovered in Alzheimer's research, which has led to over $1.5 billion of funding and grants being given out to follow on Alzheimer's research programs in the years that followed this initial paper. So, in 2006, there was a paper published in the journal Nature about amyloid beta proteins that impaired memory in brains, which then became kind of the leading theory for the cause and the driver of Alzheimer's disease. And much of the research and funding that followed from there, which is now up to several $billion in total funding in private and public institutions. Last year alone, the NIH funded $287 million in research into amyloid beta. And it turns out that the initial paper was shown to be fraudulent. And so, just recently, the journal Science published in detail an analysis of the photos of the Western blot measurements, the protein recognition images that the scientist used in this initial paper were forged, and that many papers of his were then forged years later. And this paper is one of the most cited papers in Alzheimer's research, and much of the work that's been done on Alzheimer's came out of this. And if you guys remember last year, we talked about that Biogen drug. That Biogen drug is meant to stop amyloid beta plaque. And the projection is that Alzheimer's drug, and remember, there was a panel of scientists that looked at the data for that drug that Biogen got approval for from the FDA. And they all said this does not show conclusively in any way that it improves Alzheimer's. And the FDA still approved the drug because so much of the NIH funding went into the research for amyloid beta. And so the assumption has always been, this is the cause of Alzheimer's. This is the way to resolve it. And everyone gets so strongly held in that core belief, and there's so much money behind it, that we can't turn away and say, maybe we're wrong. And this is the problem when science meets money. Once you go from funding something and then suddenly a whole bunch more money pours into it, everyone's going to look bad and everything's going to fall apart. And everyone fears that the system fails if you realize that something you did and said was so totally wrong. We could even argue this is what happened recently with COVID, the masks, the vaccines, all of the statements that were made, that you have to keep doubling down.
Every system has bad actors, people plagiarize, fraud, whatever. Is this like a systematic thing? And doesn't science protect against this because people then do double-blind studies and try to replicate studies?
Two things.
Because like Jason Blair eventually got caught, right, at the New York Times. It was only a matter of time before somebody said, like, his description of my back porch was not accurate, and I never talked to this journalist.
Let's say that you're a smart, up-and-coming scientist. Yeah. Your job is to publish research that gets attention and that you can then go raise grants from the NIH and others on. So you want to get some good papers out, you want to get attention, and then you want to forward the research that's already being done. It is to no one's incentive to go out and try and retest something that someone's already published on, even though that's what you're supposed to do in science. There's no motivation. There's no dollars to do this. It's a disincentive to your career. It's a disincentive to your ability as a scientist to source funding and to source grants to go back and retest assumptions that are already strongly held beliefs in the industry. I'll give you another strong example that just came out 2 weeks ago. You guys heard of SSRI, antidepressant drugs, right? 37 million Americans are on these drugs. The market is projected to be at about 25 billion in the next few years. That's how much Americans are spending on these antidepressant drugs.
Half a Sacks, but yes, go on.
Yeah, right. So there was a paper published in Nature a few weeks ago, and the Nature journal pulled all the research and all the data from 17 other studies that was across several 100,000 patients. And their conclusion was that there is effectively no proof that these SSRI drugs have an effect on depression, have a positive effect on depression. That serotonin and the idea that serotonin uptake should kind of have a driving effect on depression. And this has been the assumption that's been held now for many years. I mean, I think the original paper on this was published probably north of 20 years ago. But the industry is so big, right? The drug companies are making $20-25 billion a year on these drugs. And scientists are incentivized to further that research that supports that research. And so they can go out and get NIH grants because it's already an accepted, proven belief that this is driving.
Is there a solution to this? Like for every dollar that's spent on primary, a dollar needs to be spent on double-blind testing it and making sure that it's accurate? Because we have this issue in journalism, right? Everybody's a content creator, reblogger, and opinion journalist, but there's very few now investigative journalists left.
The actual problem is peer review systems entirely, in my opinion. Like the problem with this study is that this was done by an up-and-coming researcher in 2006 at the University of Minnesota, under a researcher who was well-known. And so there was zero incentive, as Friedberg said, to really push back. When well-credentialed scientists tried to find this amyloid beta star 56, they couldn't find it. And lo and behold, those articles don't get published because they don't get accepted. Why? Because it unravels the entire game that folks will play. So, if you're a well-educated PhD with postdoc in the right places, supporting other people, it's just a loop that goes on forever. The article goes on to talk about how that person who wrote that initial article eventually got this very prestigious multi-year grant from the NIH by a person who was his reviewer who worked on the 2006 paper with him. I mean, these are some pretty blatant conflicts of interest, but the reason they don't get uncovered is like, who's going to step in and all of a sudden become the...
Let me strike an analogy here. There's a seedling of fraud here, obviously. Some guy took some friggin' photos and photoshopped them and doctored them or whatever. But we then tell ourselves stories. And those stories get us access to money, which allows us to pursue more science, which is meant to forward the market. And then eventually the market gets forwarded so much and you spend $1.5 billion and it turns out the whole thing doesn't work. Just like stock markets, it starts out as a voting machine in the beginning and it's a weighing machine over time. The same is true in science. You will have a voting machine in the beginning where everyone has some belief, some theory, some hypothesis, and they all want to believe it and they forward it and they fund it and they fund it. But ultimately, if it's not true and it doesn't actually resolve in real world change, the market will collapse. The stock will collapse. And that's what just happened with amyloid beta and Alzheimer's to a large degree. There's $1.5 billion market cap, you can think about it, or $1.5 billion of funding that's gone into this product idea.
That's per year.
Well, no, there was $1.5 billion of NIH funding over time. This is just the NIH money.
No, what I'm saying is the NIH budget per year for Alzheimer's and dementia is $1.9 billion.
Yeah.
And half of it, if you look at the tags, if you just search the tags, half the money has gone into Alzheimer's disease, amyloid beta. So the point is, you could orient the terms you used and the way in which you wrote your grants to disproportionately affect the likelihood of getting money. Separately, there's a whole body of researchers that have felt for a very long time that specific forms of infection, viruses, Lyme disease could actually be a precursor to Alzheimer's. And it has been poorly researched because the funding dollars weren't there. So
there's a lot of other theory, mitochondrial dysfunction. Yeah.
So Friedberg, when we look at this, a bad actor committing fraud can send the entire deployment of capital in science on a multi-billion dollar...
it's the trajectory of the human race. Come on, it's not just about we didn't get the dollars in. It's if you don't take the path, the drug doesn't get discovered. That's a really big deal.
And now the drug is in the market. Biogen gets approval and people start taking it and we're seeing the data, it doesn't work and no one wants to use it. So the market has collapsed and you kind of go back to the origin. It's like the market collapses ultimately. The weighing machine happens because the science doesn't work. It's not there. And there was no incentive. No one got paid along the way. Imagine if there was a bounty program to go and disprove papers. I mean, imagine if there was a system
That's what I was talking about. What is the safeguard? And we do have that in public markets. It's called shorting.
No, there is.
Short stocks.
It's called PubPeer. The problem is if you go to PubPeer and all of a sudden put your name out there as someone calling it out, you're professional career inside a research institution is finished.
Right. If your job is to go and
heroes?
No, if your job is to disprove other people's stuff, you don't forward your career, right? I mean, it's a real challenge.
Those people should be heroes. Those are like bug bounty programs. They have to look at it like bug bounty programs in tech or shorting stocks in.
The problem is that this community is extremely small, highly specialized, and their impacts are enormous on all of society. But you can't replace them with somebody else very easily because it takes an enormous amount of expertise. Like if you read that Science article, the amount of work, Science took 6 months of due diligence before they even had the courage to put this thing out there. They had all kinds of different teams trying to prove what this guy had found before they were willing to put ink to this thing.
Yeah, when things are starting to feel like they're ultimately moving to market or getting to market, the more money starts to flow in. Another good example of this is Zymergen and Ginkgo. Okay, so in the past week, Zymergen was acquired for $300 million. It was announced that they're going to be acquired by Ginkgo Bioworks, both of whom are public companies. Ginkgo went public at, I think, a $20 billion market cap as a SPAC a few months ago. Zymergen went public at $4 billion or whatever they went public at. Zymergen being acquired for $300 million comes off of them having raised a total of $1.5 billion of capital from many investors, including SoftBank, and in their IPO since they were founded in 2013. Both of these businesses do exactly the same thing or similar things, which is pursue the industrialization of synthetic biology. Synthetic biology has been talked about, or pursued for 20 years in an industrial setting. The kind of Gen 1 of synthetic bio companies was Amyris, Ginkgo, Kior, Solazyme. These companies were all engineering cells. You change the genome or the DNA of the cells. You get those cells to make a product you want them to make. You put them in what's called a bioreactor and they make the product. You can make bioplastics, you can make animal proteins, you can make fuel. And so these, and you put sugar water in the tank. So you're programming the organism to make stuff for you. And there's a lot of technical challenges, right? How do you change the genome? How do you get it to be more productive? What are the environmental conditions of the bioreactor? How do you scale this thing up and so on? And so many of them had early stage proof points and then extrapolated out that this is going to work at scale. So all the Gen 1 companies largely failed. Ginkgo, Kior, Solazyme, they were all trying to compete with the price of oil and they lost. And so they could never the science worked in the lab, but getting it to a big scale, there was a million things that suddenly were kind of proven or disproven along the way. And they all kind of pivoted and became cosmetics companies and kind of did high-end food and other stuff. And then Ginkgo and Zymergen were kind of Gen 2. They were like, we're going to reduce the cost, improve the time scale of these synthetic biology programs. And they started using industrial robots and arms. Zymergen made a bunch of kind of strategic errors where they were like, we're going to make the product and design the organisms. So it took a lot more money, a lot more time. And as they kind of stepped up and tried to scale up, turns out a lot of the things that they believed to be true weren't quite true. But the CEO did a great job selling the story. Josh Hoffman, he went out for years and he told everyone, we're going to kind of create this factory and we're going to make everything in the world using biology. It's going to transform the world. And
You've talked about this. Is it a true story?
Yeah. And so look, there's so much of the fundamentals are true. But the industrialization, the amount of capital these guys raised and what they promised they would deliver on when turned out not to quite beat the economics, not to quite get there. And the market decisions they made about what products to go after, how quickly to scale up, building their own facilities. There was just a lot of strategic errors. And I think the storytelling got ahead of where the business was. We saw this a lot in other businesses in the past years. We've talked about crypto and other markets. But these were really key examples because the science is so compelling. And the narrative is so compelling. And if it's right and if it works, it changes the world. And I think the same was true of amyloid beta and Alzheimer's. Everyone wanted it to be true. SSRIs, everyone wants there to be a cure for depression, that you take a pill and you solve depression. Everyone wants to, have a drug that you take and it ends Alzheimer's. Everyone wants to print all the world's products in a factory using cells. But there's a lot more to it. And as you kind of get through the nuanced 10 to 20 year cycle of science, moves to technology, moves to industry, those stages are wrought with errors and issues and ultimately may not actually yield what we expected it to yield. And those stories start to fall apart. And that's what happened with Zymergen. They're getting bought for nothing.
Will we look back on this, Friedberg, in 20 years and say, hey, yeah, these things were total train wrecks. They flipped the car, but it was a step in the right direction. And yeah, that was
100% step in the right direction.
We burned that capital, but something will be built on top of it, just like mainframes or mini computers to smartphones.
The first system of, call it synthetic biology, or recombinant DNA, where we took DNA from one organism and we put it in a microbe to make stuff for us, was Genentech in 1978. Prior to 1978, the way we got insulin is we actually processed pig parts. So it would take hundreds of kilograms of pig parts to make just a few grams of insulin. And Genentech took the DNA for human insulin and they put it in a bacterial cell and they made human insulin in a bioreactor. And that really kind of ushered in this era of industrial synthetic biology that all of these companies kind of followed suit to do in different markets. But remember, biologics, the entire pharma industry and biologic drugs is all made this way. We take the DNA to code for certain antibodies or proteins, we put it in microbes, and those microbes make those products for us. That biologics drug industry is a $350 billion annual revenue industry today. And so it works. It's just a matter of when and what the right products are. Industrial enzymes, $25 billion annual revenue today. So there are markets that are working. It is working, but this whole we're going to change the world overnight isn't really, true. And so these stories catch up to us. And I think we've seen this where I call it science meets money. Money usually wins. And the science isn't quite there yet. And so we've seen this in kind
the Genentech story is amazing. I mean, Tom Perkins from Kleiner Perkins fame, willed that company into being, and it's pretty amazing how in the old days of venture capital, they basically built these companies like you're doing today, Friedberg, in a production board model. He basically incubated Genentech and then surprised the world with hey, we have synthetic insulin here. It was truly a revolutionary moment for Silicon Valley. Yeah.
There isn't a single material or food or a fuel or product that we ultimately won't be able to make using synthetic biology. It's just a matter of how do we get from here to there. And the storytelling kind of gets you a bunch of money and then you get ahead of your skis and then boom, you fall down. Same happened in Alzheimer's, same happened with SSRIs. And I think we'll see this happen a lot. But when science gets exciting, a lot of money gets behind it. And sometimes it can kind of, get ahead of its skis and fall down. But
Sacks, how excited are you for this revolution in synthetic biology?
Sacks is an investor with us in one of our companies in synthetic biology. He may not remember, but he's got some money in. I won't name the company, but he's got some money.
Oh, yeah. How's that doing?
It's doing well.
Did you fall asleep in the board meeting?
No, we're not on the board. We're passive. Is that the one we brought you, Friedberg?
Yeah, well, it was 3 people brought it to me, but I've known them since they were small. But yeah,
okay. No, there was a deal that came in that looked interesting, but it was a little bit out of our area, so we went to Friedberg with it.
But it is an interesting business because these guys provide a tooling service to other synbio companies, and so it's a recurring
picks
revenue
and shovels.
business.
Yeah,
it's a picks and shovels, exactly. Yeah,
it was very SaaS-like in that regard.
A babushka doll of nerds.
Yeah,
unbelievable.
Nerds
all right,
nested
so
in nerds.
we've woken. Sacks is awake. Okay, Sacks.
Well, we're talking about an area where I'm not going to be able to contribute a lot to the discussion of SSRIs. I'm not going to pretend to know.
Yeah, I'm just a consumer. I'm not. What do I know? I just buy.
Sacks, have these SSRIs helped you in any way with your depression about Biden? No?